Repeat, there are 5 segments. The first segment extends from the origin of the PICA from the vertebral artery, which lies anterior to the medulla. Hence, it is called as the anterior medullary segment, and it extends up to the medial border of the olive. The P2 segment that is the medial border of the olive, is the site of origin of the 12th nerve, hypoglossal nerve rootlets. And the P2 segment extends between the medial border of the olive and the lateral border of the olive. And this segment is called as the lateral medullary segment and lies between the 12th cranial nerve rootlets and the 9th and 11th cranial nerve rootlets. And then the P3 segment extends from the lateral border of the olive, and it goes down to the tonsillar part and then goes up to the middle of the cerebellum. So this is called as the tonsillo-medullary segment, where we also have a caudal loop. We have the caudal loop here in the tonsillo-medullary segment. And then is the P4 segment, which goes up to the floor of the 4th ventricle and roof and forming a cranial loop here. This is called as the tilo-velo-tonsillar segment. And after that formation of the cranial loop, it enters into the cerebellar fissures and forms the P5 segment, that is the cortical segment. So these are the anatomical triangles which we need to remember as far as this PICA is concerned. Okay, so this anatomy. So we will see this anatomy once we do the forlateral or the suboccipital craniectomy. And once we retract the cerebellum, we will be able to see this anatomy. So this anatomical structures are, there are various triangles which is being integrated into this structures. So it is called as the superior hypoglossal triangle and inferior hypoglossal triangle. So it is basically the hypoglossal nerve which divides this into 2 triangles, the superior hypoglossal triangle and the inferior hypoglossal triangle. So this is a line diagram. Just remember this line diagram. So the superior hypoglossal triangle, though it's a triangle, it's actually a rhomboid fossa. So it is bordered medially by the medulla, superiorly by the 10th cranial nerve, and inferiorly by the 12th cranial nerve, and laterally by the 11th cranial nerve, spinal accessory nerve. Whereas the inferior hypoglossal triangle is bordered medially by the medulla, laterally by the spinal accessory nerve, and superiorly by the hypoglossal nerve. So that is what we see here also. The superior hypoglossal triangle bordered superiorly by the 10th cranial nerve, medially by the medulla, and inferiorly by the 12th cranial nerve, and laterally by the spinal accessory nerve. The inferior hypoglossal triangle, which is being bordered medially by the medulla, superiorly by the hypoglossal nerve rootlets, and laterally by the spinal accessory nerve. So orientation of the PICA with respect to these triangles is very, very important in clipping of the PICA aneurysms. So this anatomical orientation is very, very important and crucial, because the clipping type, the type of aneurysm, the approach varies based on these triangles. The dissections of the vessel will vary. So orientation, once you do the craniotomy and once you open the dura, you should be able to orient the anatomy with respect to these triangles. So these are the various aneurysms which is being illustrated here. So these pictures are taken from the Lawton's 7 aneurysm series. So you can refer Lawton's aneurysm series to have an in-depth knowledge on the aneurysms. And whenever you go for the aneurysm surgeries, always brush through all these anatomical part. It is very, very important that every time when you go for an aneurysm surgery, brush up the anatomical part and then get into the surgery. So these are the various aneurysms of the PICA with respect to the hypoglossal triangles. So here you see the aneurysm in the superior suprahypoglossal triangle or superior hypoglossal triangle, which is between the 12th, 10th, 11th, and the middle border of the medulla. So in this triangle, you are seeing the aneurysm here. So here you are seeing an aneurysm underneath the hypoglossal nerve. So here you are seeing an aneurysm in the infrahypoglossal triangle. The infrahypoglossal triangle between the 12, 11, and the middle and the medulla. Okay, so here we see the aneurysm of the PICA in the infrahypoglossal triangle. And here you see a distal aneurysm. So these are the 4 possibilities of a PICA aneurysm based on its location. So either the aneurysm is in the suprahypoglossal triangle, or it is in the infrahypoglossal triangle, or it is under the hypoglossal nerve, or it could be a distal aneurysm.
கடல்